9:14 is the time right now. Each year at WUSA 9, we celebrate breast cancer survivors for Breast Cancer Awareness Month. It's all part of our Still Standing campaign, which is meant to make a positive impact on those impacted by the disease. But it's also a time that we like to inform the public about the many resources that are available to help. And joining me now to talk about this is one of our partners in this effort. This is Dr. Dawn Johnson Leonard, a breast surgical oncologist at Holy Cross Health Cancer Center. Good morning to you.
Good morning.
Glad you were able to join us this morning, and we appreciate it. First of all, let's talk about the whole screening. Let's start there.
Yeah.
What do we need to know about the screening process right out of the gate?
Screening is easy as 1, 2, 3. For women with average risk, we recommend starting annual mammograms at age 40. We recommend they also have annual clinical exams by their primary care doctors or their providers. And you know, those of us in the breast industry still recommend self-examinations as well.
Right. What can women do to reduce the risk? Is there anything they can do to reduce the risk here?
Absolutely, absolutely. Again, that's the 1, 2, 3. Healthy diet, exercise, weight loss if needed, avoidance of smoking, avoidance of high fat and poor diet, reduction or loss of alcohol. All of those are things that can help. Sedentary lifestyle is the great killer now, and even more so, fear. Avoiding that fear.
Wow. Okay. All right. Let's talk about you mentioned exams, and you mentioned one of the things you mentioned was the self-exam.
Yes.
If you find something during the self-exam, obviously you're probably more than likely you're probably not a doctor. What should you do?
First and foremost, don't panic. Repeat your exam. Some will say give yourself about a week. If it goes away, it's most likely benign. If it persists, call your provider, report the finding so they can do an appropriate workup. And if that provider is not listening to you, and if they're not taking your concerns seriously, find another provider.
Right. It's good that you mentioned that, because I actually had personal experience with this. My cousin, one of my close cousins, did this, but the provider didn't listen to her, so she had to go somewhere else, and it turned out to be way more serious. Having said that, is there any other advice that you could give to people out there that could better prepare them for any scenario or any situation to get ahead of this, or when they're going through it?
I think the most powerful thing is that knowledge is power. Be your own self-advocate. Fight for what you need. Fight for what you want for you and your family members. The other thing is to share information. Know your family history, know your personal history so you can understand your risk, so you'll know what to take more seriously as well.
All right, Doctor, thank you very much. We appreciate your time.
Absolutely.
And sharing that important information with us this morning. Thank you very much.
Thank you.
All right, let's get over to Jonathan now and talk